Good morning, everybody. Welcome to the Women's Caucus meeting. Today is Childcare Provider Day. And this meeting has been organized by the chair of the event, Delegate Pam Queen. And I'm just going to turn the meeting over to her because she's done all the preparations, talked to all the participants, and she will explain how the day will go. So Chair Queen, can you get started, please? Thank you.
Sure. Good morning, everyone. Glad to have you here. This is Childcare Provider Day. Can you see my screen? No, you can't. Give me a second.
We can see your screen.
Oh, you can see it. Okay, I am sharing. All right. There we are. Okay, so we will get started today. Good morning. We just had remarks from our president of the Women's Caucus. We will start with the Pledge of Allegiance. I pledge allegiance to the flag of the United States
of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. So this morning, as mentioned, we will have our panel discussion for our celebration of child care providers. We have three great, outstanding advocates of child care providers from our area. You may know many of them. And so that'll be part of our morning session. And then this evening, we will have our in memoriam program, which will also be live streamed. This program is being recorded as well as live streamed, where we remember several child care providers who we lost to COVID. So we're going to get started with the child care providers. They will all speak 10 minutes each. And then afterwards, we'll have questions. They're going to outline some of the key issues related to them, as well as some asks for our caucus. And so we will first hear from Christine Pusch, who is the Executive Director of the Maryland Child Care Association, then followed by Laura Will Dreyer, Executive Director of Maryland Family Network, and then Ruby Grace Daniels, President of the Maryland State Family Care Child Care Association. So we will get started with Christina.
Great, thank you so much, Delegate Queen and esteemed caucus. I'm honored to be a part of this panel today with these fabulous ladies, and honored to be here with this caucus, who I, as researched, founded in 1972. The Women's Caucus in Maryland is one of the oldest, is the oldest in the nation. So I am proud to be with you trailblazers, diverse, strong women leaders, working for public good, as it has a lot of commonality with the programs and providers that I represent. And we're so grateful that you are recognizing childcare providers today and instituting this special event. I would like to tell you a little bit more about MSCCA. If you're not aware, is a statewide nonprofit organization of over 4,800 members working in the field of early care and education. My membership is representative of early care and education sector across our state, which is led by essential undercompensated workforce of primarily strong, diverse women, women of color, women leading as childcare and early childhood educators, owners, operators of primarily small businesses that provide a critical lifeline for employers and the economy and help keep the Maryland workforce working. So you can go to the next slide. Delegate Queen's helping me. Thank you. Great. So I wanted to give you a little background, as my other panelists are going to give you a lot of information as well. But I found that it's easier to share a little bit more about what childcare is. And we know, especially the pandemic has shed light on the fact that childcare is the backbone of the economy, and it's essential. We know that brain development, 90% of the child's brain development happens before the age of 5. and that we have critical work that we do every day, serving children and families and preparing them for kindergarten. One thing we also know is that childcare, that parents and families spend in Maryland somewhere between 17 and 31% of their average median income on childcare services. So it's a top 3 household expense, and the national recommendations is closer to 7 to 10%. So that's an issue I hope that the caucus we can work on together. I also wanted to mention that the every year Ready at 5 puts out data for kindergarten readiness, and the child care centers and preschools that I represent always have children ready to learn at the highest rates. And including this past year and previous years, we had children ready to learn at 62%, which is the average for the state was only 47%. So I'd like to give credit to these amazing people working in this field, preparing children for life and for kindergarten. So as we go on to the next thing, I wanted to share a little bit about the landscape in Maryland of child care and what that means. So Maryland law prohibits unregulated care of children outside their home by a paid person who's not a relative. And the law covers arrangements in which child care cannot be provided for more than 20 hours a month unless it's your own children or relatives. And so a lot of people don't understand that. Parents, leaders such as yourself. So for example, nanny sharing, if it's not your own children, is illegal. There's things that are illegal in Maryland. So these are statute, and we have very strict regulations. So Maryland has some of the strictest in the country. We have strictest ratios, staffing program standards, close to 50 pages of regulations in Comar. We do have in many areas of the state unlicensed childcare that continues to be an issue. And our goal is to work with them to become licensed, to recognize that they're providing a service, and we want to get them to a licensed status, which there is funding for, and it's not super complicated and provides a lot of safety, necessary safety foundational steps to keep children safe and to also prepare children for the next steps. So there's some things, for example, that some of you have helped with and that we've done over the years, including a law requiring license number to be added to any type of advertising that you do. So that was helpful in our fight against unlicensed childcare. And then the violations for childcare regulations is a misdemeanor with a maximum fine of $500. So again, we really focus on licensed, registered, regulated care, as it keeps our children safe and also provides a standard of learning. You can move up to the next one. Thank you. Okay, so I also thought it would be good to share a little bit about what it costs for childcare in our state. So this is an average of what it costs. So for example, you can see, as I said, it's a top household expense, and we do spend well above what the national recommendations are on childcare. But the average cost for an infant and in center-based childcare, and then for an infant and family, and so on for 2 to 5, and then school age. I just wanted to give you a few more numbers. Howard County, the average cost of care is $385.09 and $266 for 2 to 5-year-olds. And then in Montgomery County, it's $404.50 and $308 for 2 to 5-year-olds. And Allegheny and Garrett County are the lower range at about $125 to $140. So that gives you a little bit of scope with regard to costs of care and what that looks like for our families.
Is that a month or a week?
That's a week. That's a week. So it's expensive, and it's expensive for lots of reasons. Not because childcare providers are making a lot of money. The average salary for a childcare teacher working in Maryland is about $25,000, between $25,000 and $26,000 a year. So we're barely making minimum wage. The regulations are very, as I said, necessary, not complaining, but they are what they are. And so it limits income and it limits the amount of children you can have. So that's how, and everything continues to rise, all of our fixed costs. So Yep, this is what it cost as of the data from Maryland Family Network from 2019, 2020. So I wanted to tell you that, it can be higher or lower based on your geographic demographic area. So you can scroll up some more so we can talk. I just wanted to give you a little bit more about the business aspect, and then we're going to talk about the crisis. So I was able to come to your retreat a while ago, and I shared some information a few years ago about the business model for childcare. So childcare is primarily, this is an Anne Arundel County program in Pasadena. Well, it's for profit, and it's licensed for 63 children. So you look at the tuition that's brought in and where the most of the money comes from, and that is for staffing. So that is where most of the money is attributed, that when we get payments, as I showed you before, from our families. So then it shows you the staffing, the property, and the operations and supplies and such. And all of this has risen. And I'll show you some more figures as we look into the pandemic. So this one is from Anne Arundel County, and you can see the breakdown. So graphics are always fun. And then the next one is from a nonprofit, a larger nonprofit in Montgomery County. So if you want to scroll to the next slide. Great. This is Rock Spring Children's Center, which is a nonprofit that has infants through school age, and they offer, a much higher, you can see the difference in the payroll and the property and the operations, the costs, but still, if you take a look at staffing, 72% goes to staffing. So these are, again, costs that we need to be sure we're paying a fair wage, and we wish we could pay more. And this compensation of wages is part of what is the issue with the critical workforce shortage, which has been exacerbated by the pandemic, obviously. So the fear and frustration was again compounded due to the pandemic, but we had a problem with the workforce shortage before this happened. So you can scroll up. Great. So now I'm going to say, in the best of times, our industry operated on razor thin margins, and we're all concerned about the childcare industry because our revenue is unstable. And so our childcare centers across the country, big and small, are profit and nonprofit, are teetering. Enrollments decreased since March of 2020 and has never fully recovered. We have extra expenses, including the PPE, deep cleaning and sanitation supplies, extra staffing that we have to adhere to meet the childcare specific CDC guidance. And they're piling up, along with the costs that are skyrocketing for some of the, even for food, for PPE, for sanitation. All of those have sometimes tripled or quadrupled in paying for these much important items needed to continue to do business. And there we go. Enrollment, as I said, according to, the surveys, and I know my next panelist is going to give you a lot of data about this, so I don't want to spend a lot of time on the data, but a lot of our programs have had to take on personal credit and use their credit cards and tap into their savings to stay afloat, if they even have been able to stay open for essential personnel or for the additional phases that we've gone through in this pandemic. MSTE states that, and I think you just got an update from them that Delegate Queen or Catherine has provided, and I think we're up to 88% of childcare centers that have reopened at this point, but that number is not exactly accurate. It's accurate that they may be open, but they're not functioning at their capacities. They have a severely diminished capacity, and they are probably, at somewhere between 50%, some a little higher, some a little lower, depending on where they are and whether their families have been able to come back. But when the loss of these programs is about 1,238 programs we've lost since 2020 and 2021, March to March. 1,238 programs is a lot of programs that haven't reopened, and almost 500 have closed permanently. And so when you look at those numbers, pre-COVID, we center-based childcare cared for 187,569 slots. Family childcare had the capacity to care for 41,243 slots and children. So losing the percentage, I think Family Childcare, which Ruby will speak to, has lost 8%, and we are, have lost over 12%. Those are a lot of slots and a lot of access problems for families in the future as we recover. So that's an issue that needs to be brought to light for your Women's Caucus, as childcare is one of your priorities as well. Okay, and then let's see. I just wanted to bring to your attention again, as we speak about women's issues, there are fewer women in the country's workforce today than there were before the pandemic because of childcare issues, and there's no recovery without childcare. Women dominate the childcare workforce. They're mostly small businesses, as I said, and minority owners and operators. And we need to be concerned about supporting them and utilizing the federal funds that we have gotten and will continue to get efficiently and appropriately to stabilize and then recover. You can move on. So next slide will be, I just wanted to mention that according to the Center for American Progress, the racial disparities in childcare are an issue that many have been affected by. Communities of color have been affected by the pandemic, and parents have had the disparities in childcare and the disruptions more so than their white counterparts. And so we need policymakers such as yourselves to work with us to act in order to not deepen this crisis further. All right, so now I'm going to show you, as we talked about the pandemic, here's some of the losses that have been incurred by the same two programs I spoke about earlier, and that is Granny Annie's in Anne Arundel County. And as you can see, they're on track to lose over $100,000, but their losses are $180 per slot and an average monthly loss of $11,345 as a small for-profit in Anne Arundel County. This is a snapshot, as I said. And then Rock Spring, if you take a look at their losses, their monthly loss is $55,000. And the reason I'm sharing this is because when you see that we the money that we have received from the federal government, both the CARES Act, the Relief Act in December, and now the American Rescue Plan, we'll never recoup these losses, but we have to find a way to get money into these programs so that they can remain viable when families are fully back to work in our state. And so their own lost $334,000 in 6 months. Okay. And so what do we need to do? So on the left, I would say the critical need is for more resources, better supporting parents' needs for quality care. We need to increase and expand childcare businesses and to improve the wages, as I talked about earlier. And there's a quote on the right, from one of our members, and that we need our money to go directly to childcare providers in grant form and help us to get our finances on track for long-term survival. So there's, immediate, and then there's long-term, and we need to talk about both of those. And so families will suffer without a rebuilding and recovery plan. And we hope that we are on our way to that as we continue to get money from our state. But I would like to mention that I have heard the cries of our members that have been struggling, as I know my counterparts on this panel have as well. And MSCCA has worked very hard. We have reached out to the governor's office. We've written letters. We've met with MSDE, we met with legislators, and we thank you for your support of the Child Care Provider Act, which I know that you were sent testimony, and we appreciate that. And we have provided a rubric, funding formulas, ways to get the money out efficiently with understanding diminished losses. We still have not been, our community has not received any money from the December relief packet. They've applied for grants. The grants, they were not transparent with regard to how much they would even receive. There was a range. And I would say that, the issue is that, the range was for $2,400 to $60,000. The application didn't really give information about the real losses that were incurred. And, our counterparts in Pennsylvania followed a similar model that we expressed based on slots to MSDE. And that program offered between 4,400 and 90,000, and providers knew exactly how much they could count on from the day the program was announced. So I feel like I'm hoping that you can help us with working to make sure that that's a similar transparency and expediting the $500 million that Maryland will receive very soon, on top of the $130 million we already received and are still waiting for grants to be given out. So to put this in perspective, if you can scroll up, but what we still need to do is that we need to ensure that the state board, who is the authority for, technically for MSDE and with the governor, understands the scope of the childcare crisis. And we did testify yesterday at the state board meeting, and has, that has been building for a long time. It's not brand new, but the pandemic certainly has made the impact much worse. And that we are respected as an industry and not just an afterthought within the MSD public school system. And we ask that for more adequate share of Maryland's allocation of the federal funds intended to rescue in an emergency situation. From March of last year, if you did not provide essential care for workers, which they received free tuition from March to June, if you didn't open your program then, whether you were afraid, your staff didn't want to, didn't feel comfortable, you received no money from the state or the federal government, or you received very little stipends. And again, it would be $800 if you wanted to reopen, or $1,600 if you wanted to reopen, were the stipends. And what you did receive was you received tuition for those particular families for essential workers, but in some cases, programs lost money. It didn't cover the amount of money that they would have received from their paying parents. So they weren't allowed to accept any other families as well in their programs. So in that respect, those that did provide essential personnel, childcare haven't received any funds since June, unless they received childcare scholarship subsidy money that ended in July. That was based on enrollment and not attendance, and now it's all based on attendance. And so we will require a robust plan for spending of this money. The 513 includes Head Start and some other dollars, but coming from Congress to make sure we have a streamlined, transparent application. And we also have a recovery plan in Maryland that state weighed in on. And if I'm going to send those documents, if you don't already have them, to Catherine, along with the letter that we sent to the governor, and you'll have the readiness data as well that I commented on here today. And we'd like you to help us commit to increase sustained state funds and the annual budget. As I know you did support the Child Care Provider Act this year, and you supported the Family Child Care pilot. I would just like to mention that we did ask, we met with the comptroller, Francho. We did ask, he wanted to meet with us at a roundtable. He recommended that we ask for some emergency funds at the end of this year, which we did ask the governor for. And I will say we were disappointed. The restaurants got state money. Essential childcare that helps restaurants work didn't, and they're deserving, no doubt about it. But we were disappointed that childcare, wasn't thought of or respected enough to get just even a month's worth of help while we waited for federal funds to come in, because we're depending solely on federal funds at this point. And some county funds, which Ruby can talk about more. She's going to talk about the Howard County Child Care Fund as well. So I appreciate your time, and I want to yield to any questions, and of course to the rest of the panelists. And I look forward to this evening's memoriam and celebration. And I think that's it for now.
Okay, so we're going to hold questions to the end. I do see some hands, but I do want to get the other speakers in so that we can at least hear those, and then that may help with some of the questions. So I'm going to go to Laura Will-Dreyer, and let me get her stuff ready, and we will hear from her.
Okay, thank you so much. I am delighted and honored to be here. Thanks for inviting me. And really, thank you for focusing on childcare. It is a perfect issue for the Women's Caucus because it is a field that is made up of largely women and largely women of color. It's also an issue that affects women disproportionately, as you are all probably very familiar, that the burden of caregiving largely falls on women in this country, and affordable, available childcare can either be a barrier to or a support for women in the workforce. So I'm the executive director of Maryland Family Network. I'm Laura Wheeldryer. If you don't know Maryland Family Network, we oversee several statewide networks of direct service like Early Head Start and 2-Generation Family Support Centers and the Child Care Resource Centers and Locate Child Care. But also we advocate in Annapolis on behalf of policies that champion young children, their families, and their caregivers. So let me jump right in and say that last spring, as the country shut down and reeled from COVID-19, the National Association for the Education of Young Children did a national survey to try and find out what was happening with childcare. And the results were dire. It said that over half of childcare providers may not survive the pandemic. And you know what happens when there's a national survey, right? States say like, well, that's a national survey. Things are probably better in my state. So in lots of states, organizations rush to do their own surveys. And in Maryland, Maryland Family Network, conducted the survey for Maryland. I'm not going to talk about those results. The results I'm going to talk about is our repeat of this survey, which we just did in late January, early February. We really repeated the survey, which, by the way, held up the national results. Every state's surveys said like, oh yeah, that national survey was pretty accurate, unfortunately. Everybody hoped it would be something better. But we repeated the survey because I think we feel like we've lost some momentum in terms of public attention from elected officials on the crisis that is still very much happening in the industry of childcare. So the General Assembly session was on, and we were getting a lot of feedback that like, oh, childcare is reopened, things are back to normal, the crisis has passed, and that is truly not the case. I know that we're here today in large part because of COVID-19, but I want to underscore what Chris said before me, and that is childcare was in really precarious shape before the global pandemic. And providers operated on our shared line here, a razor-thin margin in the best of times. And obviously, this is not the best of times. So if you'll advance to the second slide, please. These are our survey results. And there's nothing here that I think is going to totally surprise you, and that is that things are very tough. But this gives you some data. This is survey data that's representative of every county in the state and every kind of provider, center-based providers, family providers, nursery schools, et cetera. So 79% of childcare providers who responded to the survey have experienced a significant financial loss. That's up from 67% last spring. Next slide, please. On this slide is kind of the really shocking data here, and that is that providers say that on average, they are losing $8,511 per week, which adds up to $9.6 million lost statewide by providers. Underneath, you see a graph that shows you what some of their top expenses are. I'm not going to read you the slides. I know our time is limited, but these are staggering numbers. And what business could possibly survive on this? What I want to go into in a little bit more detail is like what is happening to cause that loss. And we think it is basically the double whammy. That's an official economic term of art. I'm not sure if you're familiar with it, but the double whammy here is decreased enrollment and increased cost. So why decreased enrollment when health and safety restrictions have been opened up in terms of like group size, and obviously childcare has been allowed to reopen? We've done some parent surveying, and the number one issue here is that parents have real health and safety concerns about going back to care. Childcare providers are grappling with best practices in terms of health and safety, so social distancing, greeting kids at the door, taking temperatures. There's some rolling implications of this that mean opening at full enrollment is mostly not even possible for providers right now. But at the same time, people have lost their jobs. People are working from home. Older school-age kids are at home. So why am I going to pay to take my young children to care when all of my older kids are already at home? And I think we have real concerns on the child development front about what this means for our youngest children. Next slide, please. So I said the double whammy, decreased enrollment, which translates to decreased revenue. But actually, you want to go on to the next slide? Sorry about that. And the second part of that double whammy is increased costs. And in our survey, providers report that their monthly costs have increased over $5,000 per month per location. And what is accounting for that? Well, I've talked to some providers, as I'm sure Chris and Ruby have as well. And this is the cost of PPE. It's the cost of thermometers and having staff to greet kids at the door. It's the cost of, I've talked to providers who are going through a case of masks per day. It's the cost of Lysol and Clorox wipes, and even things like milk have been hard to come by in the last year, and costs have risen. So again, this is what's creating this perfect storm: less revenue, more costs. And that's not even accounting for some of the things that Chris talked about, which is like what happened last spring when the bottom fell out and providers were closed for a couple of months. So really devastating economic effects here. Next slide, please. So in conclusion, this has stayed stable since last spring's survey. 49% of providers believe that they may have to close permanently, that they may not stay open once this pandemic is done and things return to, the before times, as people are calling them. The state will report that almost 90% of providers have reopened, but I want to clarify for you what that means. That means that providers have submitted a form saying we want to reopen. It doesn't mean that they are reopened. It doesn't mean that they have children enrolled, and it certainly doesn't mean that they are fully enrolled or economically viable or sustainable for any period of time. So I know that it sounds like good news, although even a loss of 10% of our childcare slots, which were already stretched in terms of demand, is not great. But I just want to let you know that that 90% number may be misleading you to believe that things are really okay. Next slide, please. So this is a slide, and I know you're going to have access to these presentations. Our full report about the survey is also on our website, and I can get it to Delegate Queen if you're interested. But this just shows the kinds of supports that providers are asking for, which Chris has already touched on, so I'm not going to spend a lot of time on it. But help is needed, and help is needed quickly and easily. So I want to echo all the things Chris said about streamlining the process for these funds to get out the door. So my next slide, please. We were asked to come and tell you, what can you do to help? So some of this I'm going to repeat because I think it's just that important. The Biden administration's COVID relief stimulus act is going to bring over $500 million coming to Maryland. So not only do we need a plan to spend the money and get it out the door quickly, we really need to think about short-term investment and long-term investment. We have learned some lessons about the $60 million relief funds that Chris talked about and why it was challenging or complex for providers to navigate. But we've got to be thinking about this is once in a generation investment, public investment in childcare, or at least the past generation. Maybe there's good things to come. How are we going to invest in ways that keep childcare sustainable long term? I'm sure that there's some bills right now that seek to provide relief and invest in innovation. House Bill 944, Senate Bill 711, the GO FCC that is seeking to replicate some really innovative work around family childcare in Montgomery County. Thank you, Senator King and Delegate Solomon. And then there's House Bill 608, Senate Bill 890, which is the Child Care Provider Support Act, which kind of dovetails with this federal money that is coming to Maryland and to every state. Again, thanks to our sponsors. So the second thing I want to mention is Childcare Scholarship. This is our largest public investment in childcare right now, and it has to work for all parties involved. It has to work for providers, meaning it has to be timely, it has to be a significant reimbursement rate, and it has to work for parents. It has to be easily accessible and support high quality care. We've made great strides in Maryland. I hope that you know that in November of 2020, we raised the Child Care Scholarship reimbursement rate to the 65th percentile, but continued vigilance is needed to ensure the state's investment is adequate to support the rate increases. In other words, we increase the rate, we've got to increase the budget allocation. I would also suggest to the Women's Caucus that it might be wise to make sure that parents are being well served by Child Care Scholarship and monitor the average length of time it takes to get approved for Child Care Scholarship. Last ask, please support Time to Care, paid family and medical leave. For the past 3 sessions, a coalition of over 65 organizations and 100 of individuals led by Maryland Family Network, has advocated for paid family and medical leave. 9 other states plus the District of Columbia have adopted such a policy, but maybe you don't know that we are the only developed country in the world that does not provide this kind of policy for families. We are not doing well on the family-friendly policy front as a nation. This kind of policy, I know you're thinking this is supposed to be about childcare, but this is a foundational support to parents and the healthy development of children. And you should see this as a policy that is critical to promoting parity for women in the workplace. Last slide, please. It's just my contact information and the contact information for my wonderful, talented Director of Public Policy, Clinton McSherry. I look forward to your questions. Thank you.
Thank you. I know we have some questions. I will ask if you can put some of them in the chat. I don't know if we'll get to all of them. I want you to hear the last speaker and then we'll open it up for questions. So Ruby Daniels.
Hello, thank you very much for having me. I will talk about family childcare and what we're going through during the pandemic. And I would first like to thank the previous speaker, Laura Will-Dreyer and Chris Bush. They've covered a lot of what's going on with family childcare as well. For the benefit of those who's not familiar with family childcare is an in-home small business that provides childcare services for a small group of children, up to 8 in a residential home, mostly operated by women of color, minority women business owners that have diverse cultural and educational background. Family childcare provides affordability. We're an affordable option for working parents. We're accessible. We're conveniently located in the neighborhood, close to where the parents live and work. And we're flexible. We accommodate non-traditional hours or rotating schedule. We also provide an individualized and responsive care in the warm home environment, closely matching the child's home environment. We offer multi-age group setting, allowing siblings to stay together. Over the years, family childcare has been declining, not only in Maryland, but in the whole country. Next slide. Okay, this chart shows, it's actually, I will just explain the density of providers and centers by jurisdiction. I mean, Chris and Laura covered a lot of the numbers, but as you can see, the total capacity of all programs that were open prior to the pandemic was 110,882. According to the MFN study, 78.9% of children in the state younger than 12 years old had a mother who worked outside the home in 2020. That amounts to 807,787 kids vying for just a few available slots in licensed childcare homes and centers in 2020. Even at the height of the pandemic, 3,700 programs were open to serve essential personnel. Currently, there are 4,400 6,345 programs that are open. As you can see, even with that, we still don't have enough capacity for all our children. Next slide. The challenges that were faced by family childcare providers, just like small business, the pandemic has hit us hard. At the start of the pandemic, we have little or no income. Some took advantage of the mortgage and utilities forbearance, but by the third month, all bills were due. With little or no income, the PPP and the word loan was a scary proposition for most providers who did not want to take on additional financial responsibility. Only a fraction of family childcare providers applied or were approved in the first round of PPP. Navigating the loan and grant application process can also be difficult for some family childcare providers who lack strong computer skills. Most of us rely on our children and our relatives for technical support. Even more difficult for many of us who speak English as a second language. Many applied for grants, but were rejected for improperly filling out applications. In some counties, childcare grants were not available, none at all. So a lot of these providers did not get any financial relief. So we're still waiting. Another challenge that we face is the child care scholarship. I know Laura has spoken a lot about this, but I would like to share my current and previous experience with the child care scholarship. I am a Maryland level 5 provider in Howard County, and the child care scholarship payment, even with the 60% increase right now, is way below what I charge a private pay client. In addition, when I accept a new child care scholarship parent, it takes at least 1 to 2 months before I receive any payment. Most of the time, the financial burden falls on the child care provider or the child care subsidy parent. Our business structure. The family childcare providers, most of the time, we operate on our own in isolation and have limited access to information. Providers, especially in rural areas that does not belong to an association, were not aware of any of the financial relief that were available to childcare providers. Often, I would hear that I can't apply for PPP. I don't have an employee. I don't have a payroll. With networking, we're able to reach providers, and most are getting a better understanding of the financial relief that are available. FCCA is currently able to reach a little over 1,000 of the family childcare providers, which means we are unable to coach, mentor, network, or listen to over 3,000 providers. Our organization needs help in reaching all the family childcare providers in Maryland. The ones that are unable to reach are the ones that are in greater risk of closing permanently. I would also like to see some investment in community leaders and volunteer. Our organization, Maryland State Family Childcare Association, we are all volunteer family childcare providers. We have regular jobs. And we need more volunteers to get in and kind of have a peer-to-peer networking. Research have shown that coaching, mentoring, and peer-to-peer networking is a valuable tool in recruitment and retention of future and current family child care providers. Next slide. Okay, what we ask for is support in family and center-based childcare by allowing flexible use of funds. Trust women business owners to know what their needs are. Listen to those needs, whether it is housing costs, debt, wages, or supplies. Create a path for new providers with an entry-level licensing requirement. We need to increase our capacity. This can be a path for becoming a regulated childcare. We also want to see increase in existing program. Invest some time in convincing local governments on the importance of childcare by allowing family childcare program that serves 8 children with 1 to 2 staff to convert to a large family home that serves 12 children with 2 to 3 staff. This will increase the capacity by 4 childcare slots and potentially increase the number of providers. Barriers to becoming a large family childcare home are inconsistent fire marshal rules and regulations between counties and local zoning laws. We must retain and grow supply. Next, this is my last slide. Finally, when considering a new childcare regulation, consider the regulatory burden on family-based childcare providers. Please talk to us first and include us as one of your stakeholders. What sounds like a good idea in Annapolis does not always work in our setting. Thank you so much for your support, the family childcare community in Maryland, and for giving me the opportunity to speak on behalf of the over 4,300 family childcare providers in Maryland. This is a true celebration of the women's history, where we can all join hands together and to make a better Maryland. I look forward to a brighter future and a good working relationship with the Women's Caucus. Thank you so much.
Well, thank you. Thank you all, ladies. I think you provided us with some great information. So we will try to get a few questions. There are so many hands here. So hopefully we did put some in the chat. Maybe the questions are not in the chat. So now let me go by hand. I don't know who came first. Let me start with Senator Alfred. Sarah.
Thank you so much, Delegate. And thank you to everybody who presented. This is it was always an important topic, and now it's even more so with the pandemic. My question is related to, and Chris and I have had this conversation, it's related to the federal funds, and I think we're all very concerned that those are flowing efficiently, quickly, fairly down through the feds to the state to the providers. Can you give us a little feedback on what it looks like to be, on the ground applying for these funds, and then what can we do better as a legislature to try to direct MSDE to be more efficient and transparent and fair?
Great. Hi, Senator Alfred. It's good to see you. I think Ruby can help us as well, because I'm sure she applied for the grant. So she actually applied. I've helped people with the application and have certainly viewed it. So some of the issues is that for example, the application itself was cumbersome. It asked for a lot of financial information. It asked for information about tuition rates, which tuition rates isn't so bad. I mean, some people are a little proprietary about that, and they didn't know how it would be used because it wasn't explained. And we weren't sure why the rates were included with regard to a grant, because it had to do with diminished slots. So that was part, but the financial information, some of that, the feedback that I'm getting of Ruby, can help as well, is that it was very, confidential, and they didn't know who was getting it and how it would be used, because there was no funding formula or rubric to explain, what they could expect. For example, and I can send this to the caucus, Pennsylvania had a very clear delineation. If you have this many children in your licensed program, you can expect this amount of money. And so when you apply, then you know what you might have to pay in taxes, maybe not state taxes, but federal tax, federal tax. You need to know these things in order to make decisions about your company. It is a private business that is, struggling due to a pandemic, but these are emergency funds to stabilize, and the expediency of it is also an issue. We were told that the community was told that you fill this out by March 3rd, and they would begin processing would be 4 to 6 weeks. Then we got another communication that it would be not until May 10th that they would receive any money. And this is from the December administration and that Relief Act. Now we have the Biden administration and the rescue plan. We're not being rescued quick enough. I mean, I think when you lose 500 programs and from December, from a year or less, we were at 279 lost in December. We're at 500 lost almost. I think it was 500. They backtracked because they gave the grant was possibly opening 30 more. We're at 470 lost. But that's just, and another, the 1,200 that haven't reopened. I mean, this equates to a lot of access issues in the future.
Can I add just a really practical consideration? MSD does not is not set up to distribute checks. So when you ask what you can do, I mean, they just don't have the manpower or the mechanism to cut potentially 8,000 checks to providers. And you just heard Chris say, expediency and streamlined application are the two things that have got to be improved. So I have done some asking. Other states like basically brought in a third party, whether it's a nonprofit or like a financial vendor that has check capacity. And the reason I'm bringing up checks is because one of those pieces of information Chris just referenced is asking providers for their bank account information so they could do direct deposit, which I understand was easier for MSDE, but which felt really intrusive to some providers. Because if you think about family providers, and Ruby will say if I'm totally off on this, but that might be their personal checking account information. They don't necessarily have a business account, and they're loath to give that information to MSDE. So there are truly some logistical things that need to be ironed out before we try to do this again.
And I just want to say before Ruby, you jump in, about 4,800, we think about 4,800 applied out of the 6,700, which certainly leaves a lot to be desired. And again, as Delegate Solomon, and his great work and leadership with regard to House Bill 608, that was linking it to commerce and getting out our checks. We need some efficiencies with getting out money. I mean, the comptroller can do it if they get the information, but everything is based on how the sort of the antiquated system. I'm not blaming MSD. Their system needs to be updated and they need funds to do that. And I know the PDG grant is working on some streamlining as well, but this pandemic can't wait, for those types of things. You're losing lots of private small businesses, women working in the field who are displaced. Families will be displaced. You cannot recover without stabilization, and we have not gotten there yet.
Yeah, I agree with Chris and Laura. This is Ruby. Family childcare providers do have a difficulty in doing the loan and grant application. So I would ask for a simplified application process that would be easy. Even for somebody with good computer skills, the application process was difficult because there was a lot of barriers. If you put a period, if you put a decimal, I mean, there's a lot of things that were stopping us from applying. So as what Chris said, only 4,000 out of the over 6,000 providers applied. So there are providers who are not getting any financial relief at all. And what Laura said about having a third party to disseminate or distribute the fund might work better, because like in Howard County, I believe we use the Howard County Economic Development Authority to distribute our funds, and it was a simplified process that was supported by the CCRC. So if there's any mistake that was happening, it was quickly captured and corrected. So a lot of us were able to avail of grants. Other states have used the small business development as a third party. So, I mean, if we can get professionals to distribute the funds, I guess it would be so much easier.
And the grant.
We're going to start losing people. Our bells are ringing. Senator Rosen, can you get your question very quickly? Thank you.
Yes, thank you very much. And I'd like to address my question to both Ms. Pooch and to Ms. Daniels. I think we have to recognize that COVID-19 recovery is going to be a long process. And I think some of the ideas that came out of this forum this morning have been very productive, following up in the short term, but thinking long term as well. My question for Ms. Pooch is, I didn't hear anything about the impact on child care providers in rural areas. And my question to Ms. Daniels is, I was hearing you on the flexibility at the local level where we've had some success on working with other industries for that flexibility. So I wanted to probe a little bit more on that as well.
Great question. So for example, Washington County, they have very few center-based childcare. So center-based childcare accounts for a lot of slots. They have more family childcare, but during the pandemic and continuing, they actually have been inundated with families as the phases and people started to go back to work that they weren't able to accommodate. They had to have wait lists because they weren't able to accommodate in rural areas families that needed to get back to work. So there's been difficulty on both, in both sides of that, because there's a desert, or there's not enough childcare programs for those that need to get back to work, and some, that are struggling to, with the caps that were in place for up from March to October, there were many families that were turned away that really needed to get back to work, especially in those rural areas. So yeah, there is issues with that aspect of this as well. But then there's other areas where families haven't come back. So again, it's ebbs and flows, and there are a lot of programs that are functioning at very diminished capacities, and others that are in areas that don't have enough childcare, that they can't accommodate some of the need. And Ruby, go ahead and wait.
In terms of the flexibility of the grant application, I guess it was easier for us, like in Howard County, when they used the Howard County Economic Development Authority. The application process was very simple, and we were supported by the CCRC, and the distribution was quick. And in terms of the second round, they had the second round. When they had the second round, all we need to do was, our information was already there. All we need to do was a recertification where we just type in a number and then we're approved. So
that's the application process, but you were also talking about you might need to work with local governments on some regulations at the local level in order to expand capacity. Is that correct? And I think those could be conversations we could have with the Maryland Association of Counties, MACO. So I thought that was a great idea, and be happy to work with you on it.
Oh, thank you so much. Appreciate that. It would really increase the capacity, because the existing programs are already there. And if we have ample space or staff, of course, you have to consider the space. If you have the space and the staff available, it would be a good option.
Thank you for that suggestion.
Okay, so I want to I know Senator Eckert has a question. I think she put in the chat, and it talked more about working with the counties. We will have to close out. I want to thank the speakers. I think they provide us with great information and some actions for us to take going forward. And also I want to invite you to come back at 6 p.m. as we honor childcare providers who we lost through COVID. So again, thank you. Thank you all for coming this morning, and we will see you this evening.